National Public Health Week Forum, and that is an opportunity for us to hear from some of our prestigious public health leaders in Central Florida. I first want to thank all of them for agreeing to come and participate. I think they agree with me. Well, I know they agree with me in the fact that public health is all of us. It's not a certain population. It's not a certain community. It is all of us, and we all need public health infrastructure to be good so that we can all have better health outcomes. So thank you again, panelists, if y'all would please. And I want to also thank our wonderful partners who are sharing the stage for the moment to allow speak, and you can feel free to also come in and sit if you would like to. And I want to thank our moderators who are for the third year in a row because they're so awesome. I cannot do this without them. Doctors I cannot. So they are so awesome, and I'm sure you're going to see why I say that once you hear them. But we have Dr. Cyrus here from College of Medicine. Thank you, Dr. Cyrus. And then Dr. Sotos from our College of Nursing. So I am going for your attention, and please know that we will have questions. You can ask questions. We have, if you would raise your hands, we have wonderful students who have cards. So if you have questions, raise your hands. They will give you a card, write your question on the card, and then they will make sure that our moderators receive those, and the moderators will direct those questions to our panelists. Everybody understand? We good? All right, so I'm turning it over to Dr. Sotos and Dr. Cyrus. Thank you again.
Thank you, Dr. Cooks. We're really happy to be here again. And if there's anyone here from UCF downtown campus, we're just really excited to be here too. It's like, I feel like I'm back at home. I did 15 years at Bob Carr Auditorium. So really happy to be down here. But it's all about the panelists today and right now. And so we thought before we started, if all the panelists, just so we kind of get to know who is who, if the panelists, if you wouldn't mind, if we could just start with Dr. Pino, maybe, and go down the table, just say your name and your profession and the organization that you represent.
So good morning. Well, yes, good afternoon, everyone. My name is Dr. Raul Pino. I am the Director of Health Services for Orange County. I have to make a little bit of a differentiation there. It's different than the health department, where I used to be the health officer for Orange County. So Orange County, and you are going to see the same when when Vianca speak to you guys from Osceola. Orange County has a structure that is a little bit different than others because we are a large county. So without going too far, there are two institutions, the health department that does all that is prevention, treatment, clinical treatment. And we in health services concentrate in whatever the health department doesn't do. So we have animal services, which include our shelter, the medical examiner for Osceola and Orange County. We have the health services for corrections, so any clinical services that are offered inside our jail, which has about 3,000 individuals at any given time. We also handle the EMS services, not the services itself, but the education, training, and quality control for EMS services in the county. We also have the drug-free office that has expanded a more larger role than before. And we also have a beautiful Orange County Medical Clinic. Orange County is one of the few counties that have clinical services for people who do not have health insurance, and the county provides those services for free. So my role is oversee that portfolio of divisions.
Thank you. So I'm Ladda Thiamwong. I'm professor and Florida Blue Endowed Professor for Healthy Communities. So my endowment position can not guide me the work that we have to target the communities. And today we have the Healthy Aging Lab. We have students here, and some of us have experience with the Healthy Aging Lab too. And we are at the College of Nursing, but the work that we have not just target to the nursing student or nursing profession, but we bring the interdisciplinary team perspective in there. So several of us in the team member at the Healthy Aging Lab is an interdisciplinary team, can be engineering, kinesiology, computer science, and sociology, blah, blah, blah. So we have a lot of from different disciplines to learn together and work together.
Good afternoon. First and foremost, let me thank all the science for such a large number who are pursuing a career in the medical field. Know that the work that each of you will do will be so impactful for our success. So I'm beyond excited. So thank you for choosing the career path selected. Again, my name is Mangum. I'm the Vice President of Partnerships at 26 Health. We are a nonprofit community health. Good afternoon. My name is Vianca McCluskey. I'm the administrator of the World Department of Health and Health. Typically, what we do in health departments every night, they have a PhD of 10 months time, 67, and our job really is to protect, promote, and improve the health of really by working with partners and so that's really what we do. I was kind of mentioned they do a lot of primary care, we go to a lot of public health, ranging to environmental health, epidemiology, preparedness. Really, you think about it during this week, something that you do on a day-to-day basis. So a lot of you were interested, I think, come to the health department to do an internship, so thank you for that. We love having those able to do that. I encourage all of you to think about the thought of this career that you would do to be out there.
All right. Well, good afternoon, everyone. I'm excited to see so many public health practitioners in the audience. My name is Bakari Burns. I have the pleasure of serving as the president and CEO of the Healthcare Center for the Homeless, where we do business as Orange Blossom Family Health. And our mission is to provide access to quality healthcare services to all of our community members, regardless of their ability to pay. We do that by taking a holistic approach to caring for our patients that combines primary care, mental health, substance use disorders, pharmacy, case management, all designed to truly frequent our person. So again, it's a pleasure to be here with you, and I'm looking forward to our discussion this afternoon.
Okay, thank you to our panelists. And with that, we'll begin with some of our questions to start this year's discussion. We'll start off with Commissioner Burns and also Dr. Pino with this first question. And then if anyone else on the panel would like to respond, we'd also be happy to hear. So for this year's National Public Health Week theme, it is Ready, Set, and Action. And each of you has spoken a little bit about your programs and your services. So how, within the context of that theme, can you give an example of some of your programs or services that might be more to improve the public health infrastructure of Florida, Central Florida?
So our health services, we have to be always ready to go. Part of our division of EMS services, or what we call the medical director for EMS services, we also handle all the preparedness for emergency situations in the county, either human or nature made. And that includes also supporting hospitals in an event of a crisis, meaning standing up an ER, a mobile ER, in a matter of a few hours, if necessary, which we have practiced and done quite a few times. So the health department, we have a partnership with the health department, with the Florida Department of Health. In this case, for Orange County, they provide the personnel and we provide the infrastructure for any emergencies that may happen at any time. That include from warming to cooling centers to everything that you see during a hurricane in those shelters that we provide for the community, and especially what we call the special needs shelter, people with special needs that are electricity dependent to have care. That included people who are intubated at home, children with respiratory issues, from people who are using CPAPs overnight. So in that case, it's a most specific example on when we are ready and set to go at any given time.
Yeah, now I'll take that. Now I wanted to add something. I was addressed as Commissioner Burns. I didn't mention that I am also a city commissioner, the city of Orlando for District 6. So I have a unique opportunity of blending policy advocacy with the action of community and public health work. But when I think about the Ready, Set, Action it just kind of takes me back to how we do all things. Because with the changing landscape, whether it be political, the changing environments that we operate in, I think when we talk about being ready, we have to take a step back and look at our current realities and see what's relevant now. Because we may have been doing things one way for the last 10 years, but this new changing landscape, we have to take a step back and do an assessment. So I think when we talk about ready, it's about doing research, doing an assessment of our current situation, looking at data, statistics, and then we go into reset. That's when we start to strategically plan for how we want to implement these things. And then the action is when we execute. So a couple of things that we're monitoring right now. We truly believe that housing is healthcare because we've seen the data, we've had experiences that when we get someone who's experiencing homelessness into housing, it's easier to improve their healthcare. So we really live by this housing is healthcare mantra. One of the things that we're looking at, there's some changes that's happening in HUD. There's some resources that will be redirected from permanent supportive housing to more of treatment and transitional housing. So what does that mean for our local community? We could potentially have 500 individuals who are permanently, stably housed right now, kicked out of those programs and find themselves back into the homeless community. So again, those are the type of things that we're looking at. So we're adjusting our models to ensure that we're able to meet the needs of those individuals who may be losing their housing while we're, again, providing those services so we can prevent others from falling into homelessness. So again, that ready, set, action, I think you have to do your research, prepare, and then you have to execute.
Thank you so much, Commissioner Burns and Dr. Pino. The next question is for Michelle Mangum. And this is UCF's third year hosting this public health forum. And each year we're seeing new partnerships and how they have an opportunity to learn about more partnership potentials going forward. Why is leveraging partnerships so important? And how do community partnerships help Central Florida stay ready and set to take action in our community?
I think first and foremost, partnerships are displayed right at this thing. When you talk about readiness access, as community health providers, we so often have to be prepared to make pivots at unexpected times. When Bakari is speaking about housing and the issues with that is a barrier to care for so many people. And by creating partnerships, you have the opportunity to address those barriers and to eliminate them. One of the things that's so often said, I think a year ago, Mayor Dyer in his speech talked about a healthy community is a prosperous and successful community. When you look at communities where there are barriers and there are challenges, you can just look right here in Orlando. You can pick the communities where there's everything for low income families and see the difference and the challenges that they face that they're not as prosperous. So when you provide stable housing, when you're able to have the health department and the Orange County government have that commitment to care, you start seeing those improvements. So partnerships with community health centers, with FQHCs, with health departments, with hospitals, and sometimes smaller nonprofit organizations that may have absolutely nothing to do with healthcare, but Second Harvest Food Bank. If someone's not able to access food and healthy food, that leads to healthcare issues. So those partnerships create the environment to improve healthcare.
And if I could just add onto that, I really believe that as public health practitioners, partnerships are our superpower. Because, I think about when they say, it's the same, if you want to go fast, go alone, but if you want to go far, go together. And that's true, and as Michelle mentioned, we are fortunate in the city of Orlando, in this Central Florida area, that we have some great partnerships. One that comes to mind is the Primary Care Access Network. That's a partnership of healthcare organizations who are designed to care for people who are lack insurance or underinsured. So I think that as and when we talk about public health, partnership is definitely a superpower.
And I'll go ahead and add on to that as well, that I think it's always been a superpower, but probably also in a society of dwindling resources. So every day we wake up and things are higher with less money, right, to do it with. So again, partnerships become even more important. So moving on, these questions are directed towards Dr. Pino again and also Ms. McCluskey. And we've given some examples of partnerships, great partnerships within the community, but we know that this is important also at the state, the county levels as well. So could you please share how you've seen some examples of these community partnerships really being leveraged to address broader public health issues?
So I think the first example that comes to mind is when we just ground. So in Central Florida, we have one of the highest growth rates according to DrPH child mortality dashboard. And so I put on the child abuse death review. We review, unfortunately, every fatality that happens. And we do those if there are any indication that they collect or the use was connected to the fatality. And so these partners come together, we evaluate those cases, we make recommendations, determine if it's prevented, and the data, well, of course, very depressed, maybe on Friday after the worst time to do that, right? But these partners are really passionate about preventing drowning, and so that data showed up through several meetings that we have. That data was communicated to the health department. We started sharing that data with our county government. As much as want to see movement, things in government take time, so we continue to share that information, continue to share that data. And basically what happened, and I'm excited about that, is that resulted in the creation of the Osceola Drowning Prevention Platform for water safety. And it basically brought people from all sectors in, government, student providers, the health department, EMS, fire rescue, hotel and restaurant partners, people from all sectors came together to address the issue. And so in January, we launched through Experience Kissimmee, a platform that really promotes water safety among residents and visitors that are coming to the state. So that was one part of that. Second, we also implemented education within the school and early learning centers, targeted towards children specifically. All the kiddos get a book called Swimming Up Birds to Swim, and we read that. So again, it's about getting kids to understand that water is wonderful. You know how to use that as a tool or a resource or something fun, but it can be deadly. So all these companies coming together, focusing on the same thing, and that really all started with data, and it all started with people coming together on the things to make it work. And so we really leveraged that in the county government and all the partners to have the outcome of really something that for years and years to come could help move the needle on the data, and that takes time too.
Yeah, you both, I'm Bakari too with the Pecan Network. But I think that it's also critical that when you have partnerships, everyone comes to the table as equal. There are institutions that are larger than other ones. There are ones that have more resources than other ones, but everyone comes to the table as equal with a common goal. And that's the case of the Pecan Network, where you have nonprofit organizations that provide dental care services to the biggest hospitals in the area. And the common objective is to provide healthcare to individuals who otherwise may not be receiving. And our clinic is part of the Pecan Network. It's actually spearheaded by the county. And the idea around providing these common services to the community is also that when you offer help to an individual, you are also offering to the community at large. And that's an important piece to have in mind, because you are going to find some people and some politicians in our community that discourage the ability to provide services for those who are a higher need, for what reason that may be. But also remember that every individual that you offer help and is part of that partnership is help and health that you are providing to the community at large. And that's what is really important. When you offer services to the homeless individual, who someone who is experiencing homelessness, you are not only offering help to that individual, you are offering help to the community at large as well.
Thank you.
Yeah.
Follow up.
No, I thought there was someone on that.
Oh,
No,
no?
I might be wrong.
Okay. Next question is for Dr. Thiamwong. and for Commissioner Burns as well. So the question is, in our technologically advancing society, partnerships may have to be considered differently than they have in the past in order to keep up with the trends and the population needs. However, not everyone is comfortable or proficient with technology, aging populations, or the unhoused, for instance. How might cross-sector partnerships, for example, universities, city, government, nonprofits, how can these help scale technology solutions that support those who may be less tech savvy or have less tech access? Dr. Thiamwong.
Thank you very much, Dr. Sotos, for the question. So as you know that we don't have enough healthcare provider to take care of the population, especially the aging population increase a lot. And in Florida, a lot of people moving to Florida to retire, right? And then have a lot of healthcare issue that we have to protect and help them. So in the part of academic institution, we may not able to provide the service for the people, but we try to think about what the knowledge that we have and what the issue now. We try to analyze what is the issue, the trend, and we, especially aging population, they have several complicated issue happen to them, not only the healthcare, right? It's about environment that they live, or the housing, the financial status. So as a researcher or in the academic institution, we should come together as a team, as a researcher. But some of us may not understand the issue itself. So we have to reach out to the healthcare service partner or the person, older people itself, to understand that issue. But later on, when we understand issue, the technology can help us as a part of. We cannot do the work alone, or we just have limit of people. For example, at the Healthy Aging Lab, we can hiring maybe 10 or 5 to 10 of research assistants to help us, but we have to train them. When we train them for maybe 1 year, they know how to do the job, do all the assessment, blah, 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 and then they graduate. Now we have to train the next group come. So now the training is a part of us to help, but at the same time, when we bring the technology, we cannot use the technology to tell older people to use it because it's a burden for them. Even though myself, sometimes I cannot know how to use the iPhone, I have to ask my daughter to help me. And I feel comfortable to use it if she around me. If she's not around me, then I cannot figure it out by myself or something with. So when we bring the technology to the site, for example, right now we got the funding from the federal funding to prevent fall and use technology based to assessment. Some of you have experience standing on the table over there. You have some experience, right? Standing on the scale that we have, assess your body sway. So that technology, it means researcher be the person who use it. But after you screen your fall rates, we provide the wearable sensor, the Fitbit watch to them. We want to know that then when they have high risk to fall, what the activity level that they have, and then they have the Fitbit. But we have to help them to download the app for the Fitbit in their phone, and then show them how to synchronize the work. So all the technology in the technical support is based on the research assistant to help them, but they just be the person who use it. Then they have more confidence to use the technology. So after the study done during 6 months, we provide the wearable or the watch to them. They can use it continuing, and then we follow up again. At the first time when they start to use technology, they have issue, they call us. We have to tell them, okay, how to help. Or some of them cannot figure it out by phone call. We have to try and to talk to them in person. So we need to make time to help them in the first time to use technology until they feel confident to use technology. Later on, they can carry on. After they feel more confident, older people have more empower about themselves to know, okay, I can do that. You know, I mean, the same that my daughter helped me to use iPhone. Now I say, okay, I can do that too, or something like that. So it means we have to be intergeneration to help each other. And your guys, all the students, I think you are able to do this thing and very quick, right? But we need you to help with this. So now it means for us as a researcher or the faculty, we need to train more generation. And the committee work is to bring technology to the site, to the area that they stay, and you can see the environment that they live to, not just target on only technology, because technology is only the tool or the mechanism to help, but it's not the thing that we want to focus, right? So that thing that we think about this too, why technology is very important, and the partner is not the key too. Technology and partner have to work together and then come together to solve the problem for aging population or the other people. Thank you.
That question. I am a firm believer that we must leverage and exploit technology, because done in the right way, I think it can improve our quality of life and advance a lot of things. But the issue becomes when we have that digital divide. So when we talk about partnerships within the city of Orlando, there have been several initiatives where we would get, younger adults or the youth and bring them to our senior centers where we have the seniors, and then have the youth work with the seniors on, how to use their iPhone, how to create a social media account. And so what we started to see was that those seniors became a lot more comfortable with the technology because they had received some training, and they knew when they go to their program on Thursday, there will be some youth there to help them. So again, I think we have to make sure that we're ensuring that broadband access is accessible to everyone, because sometimes that's the issue. There could be technology, but if you can't connect to that technology, one of the things that we see with within the homeless arena, oftentimes when we are helping individuals move from homelessness to self-sufficiency, it oftentimes involves filling out an application. I don't know when the last time you all filled out an application, but when I was growing up, you just walked into the store or where you walk to work and fill out a paper application. Now, majority of applications are online. All right, so think about someone experiencing homelessness, that they're not in an environment where they have broadband access or access to Wi-Fi or even access to a tablet. How would they go about filling out those applications? So we as a community have to make sure that we come together and leverage the resources. So the health center, and a lot of the homeless service providers, we can't truly impact broadband access, but that's something that the city of Orlando can. So we have, as partners, we have to see what part of this issue that we're trying to address can we address with the resources that we have. So again, I'm a firm believer of leveraging technology, but also, the emergence of AI. That's a lot of concern about AI, the proper use of AI, and what does that mean for my job? But I would tell you, the medical field is probably one of the best fields when we talk about AI, to where I don't see a lot of jobs going away, but I think the how those jobs are performed will be enhanced. So again, we need to leverage the technology, but we need to make sure that all of our community members have access to that technology.
Just to add to that, I think also when you're talking about public health and technology, rural communities are those that are impacted most because there is not that access. As Bakari indicated, what I love that the city and the county have done at a lot of the community centers for seniors is having technology where they're young adults, high school students who are very proficient with a lot of the technology that are doing the instructional aspect of it, showing them how to do things from Facebook. And I'm really grateful whoever taught my parents Facebook. But the use of that technology, but when you're talking about rural, again, that is where a lot of the partnerships come into play. That if a health center has, especially one out in, smaller communities where there's the one McDonald's, there's one doctor's office, that typically there's not a lot of access, and that's where a lot of those partnerships come into play. There are a lot of businesses in rural communities that even for high school students who can't access technology just to do their work, they set up space that they're able to come and have access to broadband. And it's becoming the same thing when you're talking about telehealth. Telehealth is becoming very essential for seniors who can't get out independently anymore, who are not comfortable using Uber anymore. Telehealth becomes very important. So the partnerships come into place with organizations, whether it be 26 Health, the health department, and Orange Blossom Health, to really be able to provide that access and that education and training for seniors.
I think and we sit here in the middle of a dense urban center, but think about our communities are going way out almost to the coast. Our community as Osceola County goes all the way down almost to the Everglades. So connectivity is certainly an issue on that one.
Yep. Moving along, we're going to talk a little bit about the term vulnerable populations. So this is a term that we see often, we speak about it, and it includes, of course, some of the populations that we've been speaking about here today. So unhoused persons, people who are involved in the justice system or in correctional facilities, and also aging populations. But we don't really see these populations very often at the forefront of actual public health plans per se. So if some of the panelists can please remind us why it is important to include these populations specifically when we think about building a healthy community, and how can we tailor some of our programs so that we can improve access and improve the level of care for some of these populations. So I'll start with Dr. Pino first.
Yeah, I'm going to start with a very specific example. Correctional health. The individual that we have in the jail, it's a county jail, so that means people don't stay there for too long. Some people may, but most people leave within 72 hours. They post bail and they get out. So we have 72 hours to assess the health of that individual. Everyone who comes into the jail have to have a physical exam within 14 days, a full physical, before the 14 days mark. That's by law. And then what we have found, we recently decided to start doing syphilis testing at the jail. We do a combined test of syphilis and HIV for every person who agrees to have that test coming in. And surprisingly, we were expecting to find more females than male positive for syphilis. Because initially we were concerned about neonatal syphilis. Babies who are born with syphilis, a big concern, especially in Afro-American populations. So in Central Florida, is also a big concern. But the reverse of that coin is that we are finding more positive males than females. But the interesting part is that we are treating it and curing it before they leave the jail in many cases. And then 3 or 4 months later, when they come back, we have reinfections in many cases. And we are talking about significant numbers. We can have about 700 tests a month. We probably can have 16, 20 positive cases for either primary or secondary. And that has told us that we are not doing a good job in the community where these people are going back to and getting reinfected. So the plan right now is not just to do to those who want coming to the jail, but also to the extended family and extended contact outside of the jail. It's not enough to treat one individual. The vulnerable population extend beyond the people that you see in the forefront and going to hidden populations that you don't see and they don't want to be seen. And that includes people who are undocumented in the country, who don't want to be noticed. That includes commercial sex workers who don't want to be seen because they are engaged in what they perceive to be illegal activities. And it goes on and on and on. How can you address those issues? How you extend the services outside your area of action, immediate actions?
Yeah, I think the term of vulnerable population, it can be a stigma term. And if I'm with a group of part of vulnerable population, I may not identify myself as a vulnerable population, or some of them may not know that they are categorized as that group. And I think they have less resources or opportunity to be voice themselves or advocate or speak up for themselves. And it's hard for them to show how they feel, because if we not reach out and ask to them the same that you say about they cannot reach or something like that, so then they never have a chance to be the part of the policy or bring their opinion to the policy. So I think several of researchers at UCF, they try to reach to the population that they have. But when they come back, they say, okay, still have barrier. They cannot talk in the same language, or they cannot know about the culture, or they may not trust, because the trust is the key, right? When you talk to them about this, they may say, what you need information from me? How you gonna help me for what, blah, blah, blah. So I mean, the trust is the key that have to make sure that vulnerable population understand that we want to help them, we care about them. And I think it's hard to build the trust. So I think we may start with the trust, and then later on we can expand out or bring them, have opportunity for them to come to the forum or something in the policy that we have. That is, yeah.
Well, first, I think the term vulnerable
population continues to evolve and change.
Sure.
What was vulnerable, once considered vulnerable, is no longer. Seniors and adults and children with disabilities are living longer. And no one, to some extent, was probably prepared for that. So healthcare has had to change how we address that issue, or the fact that they're living longer, and putting systems in place to support our seniors, to support adults and children with disabilities in terms of what have been that traditional vulnerable population. So I think for one of my favorite terms is the pivot. I think healthcare organizations have to continually pivot to address the needs of that specific community. I think that is, and even not only healthcare, but healthcare organizations advocating for policy. There needs to be more funding for adults and children with disabilities. There needs to be more funding for seniors. They're living longer and their needs are greater. And without that funding to assist with that care, it continually creates a cycle, and it widens the gap. And then it widens that gap and that need of care.
Can I ask on the like dovetailing off of vulnerable populations to Vianca McCluskey, that if we plan public health actions to engage the population, it seems important to consider social determinants of health and relevant community data as starting points for the strategies to address these needs. What are the processes that have helped in moving data to action? And what has recent data shown regarding potential public health concerns and risks that require planning?
Very important that there's a robust planning and process that has to be in place for us to identify what the needs are in the community. And so we have a Central Florida Collaborative. This is a group of stakeholders, hospitals, behavioral health providers, health departments, FQHC, county and city governments. They all come together to conduct what they call a community health needs assessment. And this basically is the foundation of what we use for most of the planning that happens within the Central Florida region. And so that's the first start. So we come to the table, regionally, we look at that. Every county health department, every county is different how they approach it, but we approach it with collaborative. And we come together and we identify and prioritize the needs of the region. So that's one process, and it is a vendor-led process. It's a lot of documents. I think if people are mind to look at it, it's like 700 something pages. So read that on the weekend and I'll page you that. But it's a robust document. So we all have that. And then we go back to our respective areas and counties, hospital systems, and we take that data and we bring it down to the county level, community level. And what that looks like in Osceola County is we have a health leadership council. That's our local group that comes together every month to talk about health issues and needs in our community. We take the health needs assessments. We further prioritize that down and develop goals and objectives that are specific to our community. And going back to your previous question, that is how we identify the gaps, the needs of those vulnerable populations that we need to be targeting and addressing our programming and implementation programs for. So that's what it looks like. We end up with what we call the CHIPS, lots of chips and shops. So the CHIP is the Community Health Improvement Plan, and that guides our work over the next 3 to 5 years. So in Osceola County, for example, we've identified several things that we feel like need to be addressed. And those are in our objectives: drowning prevention, human trafficking, chronic disease. We have goals on diabetes and also high blood pressure, really local level, and which communities are being most impacted by those. And so our goal as the Department of Health is to promote effectiveness of health with all the regions, but we understand that certain regions impact is different based on the data. And that is where we begin to learn change. That is where we target, that's where our programs are often open to the community. So I think those two processes are really critical. You always have to start with the data. And then once you get to programming, you engage those partners and you bring them to the table. So you don't want to create a program for a vulnerable population when you haven't engaged that population. Because what typically happens is you have posted this beautiful thing, you plan, if it is wonderful, and no one shows up. And we ask them, why do you think come? Well, at that point in time, it's critical that engaging the population, if you feel like you wanted to get into it then. Because typically, really, I think that saying, nothing with for us without us is really critical. So that's kind of that cycle for us with the chip and the shawl. In our region, you guys should feel really happy and proud because we've got a robust planning process. In all of our hospital systems and all partners over kind of moving in the same direction.
Thank you, thank you. And I just want all the students and community members in the audience, you've got the 3x5 cards. If you have any questions that you would like to ask to the panelists, to just go ahead and fill out those cards because we'll collect them pretty soon. Just reminder on that.
Alrighty, while you're thinking of all your thought-provoking questions to write down on those index cards, I'll shift the conversation a little bit to talk about type of care, access to care. So can you talk a little bit, Commissioner Burns, and also Ms. Mangum, about care from a whole person perspective? So taking the mind, body, and beyond into consideration.
So, as I mentioned, at one possible area of the health question for the homes, we take a holistic approach to caring for our patients, combining in the physical health, mental health, as well as the oral health. And we see that is very important because we have to treat the whole person. And one of the things that we implemented is all of our patients who come into our health center are given the opportunity to see a behavioral health practitioner, because we've truly integrated our behavioral health services into the primary care setting, but also not just for our medical, but also our dental patients. Because again, you can't separate your head from your body, but that was what happens when that, you can do that. But also there has not been enough attention, I believe, on the impact of your oral health on your physical health, because we have individuals who died because they've had an infection in their tooth. All right, and so we have to, be intentional about caring for the entire person, but also addressing the mental health, because the mental health really impacts your physical health as well. So we take pride in again caring for the entire person, but also when you talk about those holistic services, you have to look beyond that. I mentioned the housing is healthcare. We know that how impacted if someone has housing, how it's easier to improve their health. There's this concept of food is medicine. Again, going back to those social determinants of health, food is medicine. So I think when we're designing programs, one, we have to keep all populations in mind when we're looking from a public health standpoint, but also we have to break it down and ensure that everyone has access to those comprehensive services, because we know that once we address some of those social determinants of health, ensure that they have access, we can improve their health. And for us, it was a challenge. We served Orange, Osceola, and Seminole counties, and I can remember when I became the CEO. I've been the CEO at the health center for 23 years, and I can remember I sat down and said, if someone we're in the city of Orlando, downtown, if someone is experiencing homelessness in Osceola County, we're expecting them to come to downtown Orlando to get healthcare services. That's not going to happen. And so one of the things that I initiated was we started mobile health services. So we rolled out our mobile medical unit that would now go and take those services to those outlying areas. And so really, I think we have to ensure that we're taking the services to where the people are. Right now, we have four mobile dental units and 2 or 3 mobile healthcare units. But again, we made those investments because we know everyone is not going to be able to come physically to our facility. For some of our vulnerable populations, we have to take those services right there to them. So again, I think it's prudent that we not just, we say build it and they will come. Sometimes our vulnerable populations won't come because they can't come. They don't have the access. So it's incumbent upon us to ensure that we design these systems, design our service delivery model to meet each and every need of each and every type of member of our community.
To piggyback on some of the things Bakari has shared, we definitely treat the person and not the disorder. Every person has treatment that is individualized to them. My blood pressure might be different from Bakari's or anyone else's. We're gonna be treated differently. At 26 Health, part of continuing to make sure we're able to treat the whole person is what we offer. We have behavioral health. We've expanded to having psychiatric nurses for individuals who need medication management. We have standard therapists. We have women's health resources. We have primary care. We have a pharmacy. And a lot of times those things are important that people can get all the services in one place. Get that wraparound services, so it's not, I have to go here for one thing, I've gotta go to another place to get my labs. I speak to that person, I'm notorious for if I have to leave there to go get my labs done, I can't promise when they're actually going to get done. So being able to have that, and as Bakari has shared and Dr. Pino has shared, everyone actually on the panel, is sometimes taking these resources to them. We have a mobile unit where we go out into the community to reach them. And one of the additional things that we even provide when we talk about additional needs from housing, sometimes clothing, what you eat. We have a small food pantry and we have a closet in which individuals are able to come in to get gently used clothing, shoes, not only for themselves, but sometimes their children. And that makes a significant difference for a person and how their mental health and how they face the challenges that they face each day.
And if I could add, one of the, we talked about access and partnerships, and I mentioned that we have to go where the patients are or the individuals are we're making the serve. But I wanted to just highlight that oftentimes we have to co-locate with services. So we have very great partnerships with some of our local homeless shelters where we have hosting set up right there at the homeless shelters. We have partnerships with that through our community partnership program to where we have health services that are in schools right across the street at OCPS ACE Academic Center for Excellence. We have a pediatric facility that we co-located there so we can ensure that those kids who need the care can receive the care and their parents don't necessarily have to take off work for them to get those services. So again, when we talk about the serving the whole person, you have to highlight those partnerships that allow us to do that. So again, we have to know where they are, but also find that opportunity to co-locate some of our services to ensure that that access is there.
And I want to add to that as you have become providers, access is more than having an insurance card. Access is more than even getting to the services. Access is also being your own advocate for your health. Getting educated and educating someone in what do they have to look for. There are some limitations, there are some race differences between the provider and the person that is receiving the services. There are some power dynamics when someone who is uneducated is talking to a doctor, may feel they don't have the power to do that. And also access is knowing your own data, your own health data that you want. You own that data. So just as an exercise, how many of you, please raise your hands, leave it up, and look around. How many of you know your social security number? Look around. Okay, put your hands down. How many of you know your base data for blood pressure, cholesterol, and blood sugar? Look around. Thank you. Go ahead.
Oh, okay. So moving on. So this question is sort of addressed towards the students to compel you. So we see an unfortunate trend that students often in health sciences do not consider professions or disciplines in public health agencies. So to the panelists, how can we, and starting off with Dr. Thiamwong, please, and then any of the panelists for your advice, how can we excite these young minds and interest them into future professions in public health agencies and towards public health?
Thank you very much for the question. This is a tough question because I work at UCF for this is my 10th year at UCF. I grew up in the rural area in the low income community and I'm an immigrant. But I have passion because when we go to the clinic, we have everything there. We don't need to go CVS or to get the medication, right? We have everything there, but in the low and middle income country, we still have limited access to care that we call. But when I came here 10 years ago, I learned a lot. I feel like, okay, from low and middle income country, come to the high income country, I'm gonna learn a lot of things. But in some of things is positive, some of things negative. One thing that I'm passionate about is I think the public work is the forefront of the work of a healthcare. It's not hospital work. You talk about the prevention, have 3 levels: primary prevention, secondary prevention, and tertiary prevention. If we do very good job on primary prevention, we don't have people who have disease, right? Everyone healthy can live until 100 years old. Everyone can be like that. But because we focus a lot in the tertiary care, in the hospital care, but I think not a lot of us. How many of you want to graduate? After graduate, I think you're gonna graduate May, right? Everyone? Okay, congratulations. How many of you want to work at the public health? Raise your hand. I want to see you. Okay, maybe. Yeah, thank you. 2 of you are of this. Less than 5% of us want to work at public health. And how many of you want to work with older population, aging people? How many of you? Wow, more than, okay, 3. See that? Less than 5% too. It's gonna be hard, right? That we have to, I don't know how we can convince you because it's not one person can convince, right? For example, in the research, when we recruit students to work with us, to work with older people, we go to senior center, we go to the senior apartment, blah, blah, blah. Healthcare provider, nursing, medicine, blah, blah, blah. We don't have a lot of them volunteer. Some of them will volunteer because we have several types of technology that they want to learn. They come to work at the healthy aging lab because we have a cool technology for them to learn. We have eye tracking, blah, blah, blah. So technology can attract them to come to work with us. But then we try to add on, for example, you go to talk to older people, you know how to greeting them, you know how to talk to them, and they trust you to go to work, and you provide the feedback. You mean the training that we have to make them more confident to talk with older people. So I think we may have to collaborate together between academic institution and the public to help us to maybe the healthcare service to help us to maybe after when you go to nursing home, when you go to public health class that you have, I think, I don't know, some of you may have negative experience to make you feel like I don't want to work here. I don't want to work with this because the experience that you have. Maybe we, as a faculty, we may have to create the environment to make you feel welcoming and be confident. Another thing is about the compensation. The salary is not, it's not there. And the next is about the future. What is your future? You may thought about you want to be what you want to be? You want to be work at the ER, you want to be work in ICU, right? Right, that is your plan, right? You work with, so anyway, so everyone have their plan, but later on, maybe when you change your mind, when you almost to retire, you say you want to have the life that simple, then you go to public health. That is sometimes it's too late. We want you to start when you're young and you have more energy and you want to more have contribution.
That's
True.
Dr. Thiamwong, is it like for those of us, all of us healthcare workers, there's so many dimensions that you can do throughout your career, and there's not just one trajectory. We have a really good question that came from the group, and if any more questions are from, we don't have too much time, so if you have any more questions in the group, give them to us. We want to know what you have to ask too. But we got the question about drowning, and the question was in regards to the drowning data. Are there any resources for free swimming lessons, either for children or adults, and would offering these kind of resources be plausible or effective for decreasing drownings in children?
You should have for your. So that's a great question. But yeah, so the data that we have, really initiated not just what we do in our county, but in statewide initiative. The state has the swimming lesson voucher program, which all county health departments are issued vouchers that can be used to provide free swim lessons for kids that are under the age of 4 now. So, that's something that's happening right now. There's a lot of easy partnerships going on within our county specifically that I'm really excited about. The health department funds a program with the school district of Osceola County that provides swim lessons every kindergartner. So this was a way that we fill their funding gap and support that. So absolutely cannot be different yet, because the primary reason that kids drown is the lack of supervision. So when you talk about layers of protection, there's a couple of things to think about. Is supervision, nothing can replace the adult have eyes on that child. Other things are gate latches and alarms, the things that oftentimes people will disconnect because it sounds annoying or it triggers too much, those kinds of things. And then also the ability to swim, which is swimming lessons, and also CPR. So programs like the Nudging program, our programs that are trying to provide swim lessons are all things that we're doing on support and prevent drowning from happening. But the tool that I find very interesting is we do classes, and we not just, it's not about just saying swim lessons in there, but it's really in multiple places throughout the work that we do, embedding that messaging about water safety everywhere. We have infant and child safety classes, we talk about water safety. We have outreach events in our community where we set up tables and talk about water safety. It's really trying to just kind of water bomb, right? Truly make a splash around this topic, because what we found is that parents typically are the ones who want to reach, because they're the ones who supervise, right? So I mentioned earlier, what we're finding is sometimes the children, right, especially certain children, we can get to the kid of those, and educate the children as far as water safety and also providing them the life-saving skills on how to swim and protect themselves. So you just can't go at it one way. Talk about your parents, you got to look at as many ways I can address the issue, as many populations we can touch. That kind of be different. So to answer your question, yes, there are good resources within our state, and that's actually capitalization that's going to grow more to a larger population pool. So hopefully the funding will come along with that as well.
I would like to add a little bit on that, specifically to Orange County, because I've been researching this issue in the last few weeks. We would like to take some legal approach to prevention. And it's interesting, Orange County, you know, Florida has 97 child deaths in 2023. And the data is very consistent through the years. It's younger than 5. It's mostly in backyard pools, not water, lakes or the sea. And a lot of visitors to Florida. Orange County is interesting. Although we don't make for the largest number among the counties in Florida, what makes it very particular is that we have a very high concentration of pools because of our hotels and, you know, summer vacation homes. So we have a lot of pools. And now it's a new frontier with short-term rentals, the Airbnbs. That's a major issue. And in Florida, by legislation, and I haven't been able to pinpoint the year, but a group of homes that were built prior to whatever year, I don't know if that can. Yeah, they are exempt from some pool regulations that may protect children from drowning. So there is some room that we have for improvement. Yes, there are resources to free lessons in Florida. We actually, the county funds through the health department in partnership with Roslyn Aquatic Centers. We are doing lessons for free for children, their parents, and also for swimming instructors and lifeguards. So there is a lot of room for improvement when it comes to child death and by drowning. And if you ask any EMS provider or a police, there is nothing more traumatic than responding to a children in that situation, to a child in that situation.
That's exactly what they're doing. So when we talk about the Airbnbs and all of that, vacation rentals, that's what they're, the things that would make you believe. Parents can send you one holiday. It's awesome. They're landing pages they created, and that's no targeting. They're targeting the vacation side. And they did a great job of taking a very sobering topic, because you think about industry, that's where we've got to be creative with public health. You can't tell visitors, hey, it's gonna drown, right? No one's gonna do that. That's not gonna support the visitors at the down in Florida, no one can put that from a tourism perspective because we're all about tourism. But he takes a phenomenal job in making a public health issue, making it practical and fun and communicating that. So check that out. But those are the kinds of partnerships that can help us in these big money.
We have
Something that
another
I
good
would like to
question
add
that
on.
came from the group. So if you've got a couple of seconds and then we'll go to the next question.
Autistic children, especially at risk.
Autistic children are especially at risk for drowning. It's critical.
You said children, autistic children?
Autistic children, of course. You know, it just occurred to me, just thinking off the top of my head, there was so many good resources that were mentioned here. A great student project or a call to action from this panel would be something like a creation or an update of centralized resources that were mentioned here, from the swimming to the housing to all of the integrated social services that are offered at Mangum, 26 Health and so forth. I think that would be a great project to occur. Anyway, so one question, and I have some good news for Dr. Thiamwong. So the response to your question worked, because the question is, for those of us interested in pursuing a career in public health, yay, what would be the next steps for getting involved or preparing for such a field? I would say, since we're limited on time, before I open it up to the panel, that I'm an epidemiologist. So I'm an epidemiologist that works in the College of Medicine and works with nursing people. So there's many, many ways and avenues to get into public health. I would encourage you to speak to all of the faculty members here to learn about all those different avenues, because it's not linear at all. So any of the panelists?
Yeah, I think we have to demonstrate all of the various opportunities that there are, as you was mentioning, in public health. But also understanding that the work is worthwhile and that you're making a difference. Because you can have a job, and if you go every day and you don't feel that it's worthwhile, and you're not making a difference, you won't be fulfilled. But I can guarantee you that this is the work is worthwhile and you will be fulfilled. Because I think back to my journey into public health. I graduated from Florida A&M and in healthcare management. Now, I originally went to school to become a pharmacist. Took chemistry 1045. They kicked my behind, so I changed from pharmacy. So I wanted to remain in healthcare. So when I graduated, you know, my thought was I wanted to go work for a big hospital or a big insurance company. Fortunately, two of the internships that I had fell through, and I landed an internship at a community health center. When I got to that community health center, I fell in love with the mission and the desire to ensure that everyone had access to quality healthcare services. Growing up, my mom was a teacher. I always had insurance. I never thought about people who didn't have insurance. And so my exposure to my internship got me to fall in love with this public health approach to that. Then I then went on and got a master's in public health, and then just remained in public health as well. And then that really propelled me into running for office, because I said, I believe I have a little more to give. And you might not see politicians as public health practitioners, but we are, because we control resources. The sanitation, garbage pickup, the roads, and all of these, the built environment that impacts the health of a community. So again, I think it's the exposure. What can you do next? I would say go volunteer, take tours of the health department, community health centers, these areas that you may not know anything about. But go and learn, because something that light may switch on, like it did for me, and say, this is what I want to do for the rest of my life.
And I want to add to that too, because the thing is, everyone you see here is a partner of UCF College of Nursing. Since I started working for UCF, we have students now that can go to Orange Blossom Family Health. We have students now that go to Osceola County Health Department. We have students now that go to 26 Health. We work also with Dr. Thiamwong whenever we can in the community to help with her aging research. And we have students that also now go to Orange County Medical Clinic. So these partners and panelists represent what we are trying to do at UCF College of Nursing and making sure that we understand that patients are people first. So before they become patients in the hospital or in any other setting, there are people that are part of our population that deserve someone who cares to care enough to make sure that they have the best possible health outcomes. And that starts, oh, thank you, I'm sorry. I'm sorry. But and most of you, some of you've heard me say that we have to care. So what you're doing and what you're learning from our partners, even if you don't want to work in the health department or at Orange Blossom Family Health or wherever, what we're hoping that you're gaining is information that you can use in the hospitals or in any other setting so that when you discharge a patient, you can let them know that in the population, there is still help for you. There is still a public health infrastructure that can support your needs. Now, I am sad that only 2 people want to be in public health after all of this term, but I know it's more. How many of you have learned more about community and population health information since you've been in this public health term, if you can? That's how many of you have learned of new resources through our partners that you did not know about? Then I think if nothing else, we've reached that objective and making sure that we understand how we can help the population, even if we're not necessarily that direct care, access to care person, but we can also make sure that our patients know who can assist them. So I wanted to say that because it starts with caring to care. And in addition to what Mr. Burns or Commissioner Burns said. And Commissioner Burns, I mean, these people, these are all my people. I say they're my people because Commissioner Burns and I met each other many, many years ago working for community health centers at FQHCs and national conferences or whatever. So I know him. I kind of ended up in Orlando and, well, long story, but we know each other. Same thing for Ms. McCluskey. We met Osceola Health Department and then Ms. Mangum forever. I mean, Dr. Thiamwong, I just think is awesome in so many ways. Dr. Pino, actually, when he was with Orange County Health Department, we met and we're working on things together. I try to stay engaged in the community, even if my position doesn't say, hey, you're a community person, because it's important to care. And all of them know that if I call Fayshonda, she's going to be there and she's going to try to help. Even if it's not a job, it's a mission. And sometimes if we think of going beyond the meeting and the messages into a mission, I think that we can see how we can be a benefit to our community. So I just had to say that because I believe in what we do, because I believe that there's a stigma that's attached to public health that makes people think it's for poor people or it's for certain communities. And the thing is, public health is all of us. There's not one person or one living being in this world that does not need public health or public health infrastructure. You need healthy food, you need healthy air, you need healthy water, and you need to have access to services when you need them. So it is not for poor people. It's not for rural communities. It's not for certain people that look a certain way or people who don't have access. It's for people who do have access. Because if you did not have good public health, you would not have access in the first place. So I'm going to stop there. But I just thought I wanted to add to what Commissioner Burns was saying. And I know time is short, and I know you were going to say something, Ms. McCluskey.
Right, you go to see, I think the hospital award, but just some practical things to think about. You know, if you, I'm specifically in state government, you know, when you go to the hospitals and you work 12-hour shifts and you do doubles, some of the things that public health might offer are for different hours, for more structured hours, more time for flexibility. You can get paid to go do the things you care about socially, like volunteer. Make sure you look at the benefits. You're very young now and nobody's thinking about retirement. But I can assure you that one day that you will. And so long-term spending state government and actual benefit, epidemiology, TB, I mean, nursing and public health has an opportunity to specialize and to practice autonomously, like no other field, you won't be able to do it at a hospital. So you don't know that yet, but you don't know the top people. That's really, I think, public health nursing, I'm not a nurse myself, but it is super fulfilling because think about seeing a patient and being able to take care of that patient on your own from the beginning of the visit to the end. That doesn't happen in all settings.
I can add, as a member of the nursing workforce for 11 years is a long time, but so there you do have a different sense of the types of organizations that you look forward to. And I did start pretty early in the beginning of my career in acute care and hospital, but you also, as a worker, as a nursing worker, there's a different sense of you and your organization when you work in a very big organization versus if you work in a small one, or if you work in a community-facing one versus one that is fee for service. So just my 2 cents on that one too. But
Yeah, I want to add to that. Listen, there is great science going on in public health. In the sense that, for example, the public health department here in Orange County has a clinic for HIV that have nurses specialized in infectious diseases. Has one of the largest TB programs that the state has. The jail. I know people haven't met jail. I wish you could go and see our jail. It's very, very different to the image that you have from the movies. And great care goes there, from an EKG that the nurse has done, to CPR that have to be administered to someone, to first aid to someone that may have suffered some injuries, to everything in between. And right now we have a great addiction services in the jail that take the individual with higher score through the entire detox process. So, and our salaries are very comparable to the community salaries that you see in general, because that's how we attract people to those services. So I have to put that self pitch there.
And
We
can I
have
add-
someone working corrections now.
I'm
Thank you.
ready for that one for change. I'm ready.
Can I add on?
33rd Street.
Everyone know World Health Organization, right? When we talk about public health, I think you know World Health Organization. So I feel like sometimes not about money when you work, you want to do the work that you feel like a reward work. So another thing, when the COVID hit, who's going to be the key person? I think the public health is the key person to make the people to go screening and prevent. So I think the COVID gonna happen again in the future. I don't know when, but the crisis situation. So public health is the forefront of the work, and then can help when the situation like that happen again. And then it's not only one country, it's all around the world. And I think public health is bigger than just one unit. If you think about not only in the department, but in the world, if you look at the country that have very strong public health representation of the strategy plan, then that country gonna have more people stay healthy. And right now, you know about the Making American Healthy Again policy. They try to change not that only to treat people who have chronic disease, but they try to change the health behavior. If you have bad health behavior, you should change it. So that is the role of the public health that they have to do. So to answer the question, I want to after this, want to meet with the person who asked this question if I have a chance. I want to talk more about this because we have more detail to tell you and then the direction that you should go.
Definitely connect with Dr. Thiamwong.
Yeah.
And at this point, we could go on and on and on. We have fabulous panelists here today, whether the new panelists or some panelists that are returning. And we want to thank all of them for coming in, letting us know all of their expertise today. And I'm going to hand the microphone back to Dr. Fayshonda Cooks.
Thank you. Thank you. Thank you again, wonderful panelists. We appreciate you. And if you would stay and mingle and talk to some of our other guests and our partners. And we appreciate everything that you said, everything that you did, and thank our moderators as well. And that's it. We will continue to visit our partners over in the area where the tables are, see what they have if you have not done so already. And again, thank you.